Leaders say there is a growing concern regarding the rising number of COVID cases in the state. Not only concerned about the rising numbers, but the number of people who did get vaccinated, and those vaccinations are starting to wear off.
And it was no fun. I mean, it really wasn't. I was tremendously weak.
Infectious disease specialist Dr. Steve Threlko got COVID recently after more than 2 years of treating patients and avoiding the virus.
So there's no question that we've seen a significant uptick. I mean, if you look at the medical center in Jackson, they had 2 people in the hospital a few weeks ago, 25 the last couple of days. So we've seen certainly significant increases in people with the infection.
The state of Mississippi went from minimal numbers to the latest report of 1,100 cases in a day. The surging case numbers are compounded by the state's relatively low vaccination rate of just over 50% and how long some people have gone since their last shots. Dr. Rosie Walker McNair believes the numbers are being underreported.
What we're getting is calls from patients at home who are doing home testing. They are getting sniffles, or they've been around someone who's had COVID.
The high case numbers are not resulting in the high number of deaths seen in previous COVID surges. But moving into the fall, doctors are worried that the numbers will climb higher as more people are closer together in school and indoor settings. The risk still involves those people over the age of 65, immunocompromised, or those who have not gotten a vaccination. But health leaders say most importantly is that if you have the symptoms or think that you might, there are plenty of free testing sites in the state to find out where you stand with COVID. In Jackson, Scott Simmons, 16 WAPT News.